Okay, well, it's 5:30. Let's go ahead and get started. Perhaps others will join us. So good evening, everyone. Welcome to the monthly Health and Human Services Board, Dunn County Health and Human Services Board for Thursday, March 25th. Welcome to our Dunn County residents who are watching on our county YouTube channel. I will formally go ahead and call the meeting to order and call the roll. Bonnie Barker.
Here.
Larry Bjork.
I'm here. Thank you.
Jody Cromrie. Sarah Kennedy does not appear to be with us. Bill Lamb.
Yes, hello.
Hello. Sarah Schaeffer does not appear to be with us. Perhaps we'll join later. Gary Steen.
Here.
And Chairman Bartlett.
Here.
And Sarah Stabenow is here, and Bob Colson has also joined us. Thank you, Bob.
Hi.
So we have a quorum. Is there
Hello,
any public
everyone.
comment, Krista?
There was no public comment.
Okay. Just a commercial for those who might be watching in the public. We welcome public comment, and there is a process by which you can share that with us, but we don't have any for today. So we have minutes in front of you for our January 28th, 2021 meeting. Is that right? No.
Yes, that's right.
Yes. Yes, it is. No, it's February 25th. I thought I was wrong. February
Oh.
25th.
Yeah, I guess you're right.
So I will need a motion to approve the February 25 minutes.
I'll make that motion.
I'm sorry, who moved? I'm sorry, Bonnie, thank you. Is there a second?
I'll second.
And Supervisor Steen seconds. Any additions, corrections, recommended changes? If not, all in favor of approving the minutes from February 25, please signify by saying aye.
Aye.
Opposed? Minutes are approved. Item number 4, our next meeting is scheduled for April 22nd. Unless anyone has any concerns with that date. And then item number 5. Sorry, item number 5. Some items placed at my request with the potential impending opening of the races and the increasing rates, although not sufficient, but increasing rates of vaccination, we're at a point where people are talking about reopening. And I asked that KT would share with us her recommendations for opening. I kind of get a sense that people want everything to be immediately open. And I think that's not what the health department is recommending. So I thought we would take this time today to talk about just general recommendations for reopening outdoor gatherings, indoor gatherings, mass gatherings, and so on. So KT, I'm turning this one over to you. Thank you.
Sure. And you guys see a lot of the data that I'm going to talk about as far as indicators to consider that I triangulate every time I have a question, either from, Menominee Parks and Rec or Little Elk Heart Church, that help inform the recommendations to walk them through their own risk tolerance to opening. But in general, I'm looking at a couple things. I'm looking at our 7-day case average per day. The state puts that out in per 100,000 every 2 weeks. And you can also see that the daily rates, if you go to CDC's website or the Harvard School of Public Health, I think it is actually Brown School of Public Health. I don't know why they switched hands, but it's the same interface, prevent pandemics. And so looking at the number of cases per day helps inform what kind of community spread we've got. Another thing that I'm looking at is percent positivity by test, not by person, but by test. And so that gives us a sense of, are we testing enough to make sure that we are finding all the cases And do we have a percent positivity that the CDC says is indicative of a potential for community spread? And so that designation right now is 5%. And you'll see in the materials that I've provided where we are as a percent positivity right now and where we've been recently. And then looking at whether or not the health department is overwhelmed and our health systems are overwhelmed. Back in November, we didn't have a bed if you needed to go to the hospital for a hip replacement or for COVID. We are very lucky to not have that situation now, but that is something that when people ask about should we do in-person gatherings, that I'm considering how stressed is our health system partners and how stressed is our public health system. So in consideration of all of that, we want to reopen, and we want to reopen safely within the risk tolerance of the different organizations. And so I've talked to some organizations where their membership is predominantly unvaccinated and predominantly at high risk for adverse health outcomes like advanced age or underlying health issues. And so they've decided to take a more conservative approach and not open in ways that I might consider safe to do so, like an outdoor event or stepping stones is one that we've talked through. But there are other places where their risk tolerance is much higher than mine. And so they've decided to have in-person gatherings with eating or with singing or with dancing that I wouldn't necessarily be comfortable with. But I think guiding people through their own risk tolerance process has been my predominant role. When we look at reopening in Mass or in a county-owned facility, I'm still looking at those things. And I welcome any conversation or questions you guys may have about either the specifics of the races or some of the other big events that I know that we're going to be considering, like the fair or I'm blanking on what the city event is where they bring everybody in to downtown, but things like that.
KT, do organizations routinely contact you about this? Or are there some that just proceed?
Well, I only know about the ones I know about or that are on Facebook and someone's brought to my attention. So I think there's a mixture of both. So we have amazing partners within our business community, and I've had robust conversations with the Downtown Business Association, the Chamber, and many of our other business sponsored events. There are other event centers and more personal gatherings that I don't have a touch on.
Right.
So it's a mix.
Okay. Let the record show that Sarah Schaeffer has joined us. Hi, Sarah, welcome. Thanks for being here. Do others have questions of KT about the reopening process?
Got one question.
Yes, Supervisor Bjork.
My question would be events, like weddings and funerals, and how are people making decisions on what they plan? I have a neighbor that died weeks ago, and they're planning on having something at his farm coming up here in a month or so. But are the people that would possibly be having a wedding, do they check and see how many people might be there, or is it the responsibility of the church or wedding hall or something like that to make contact with you?
So it's been a mix. I've had conversations with both event centers and with funeral directors and with individuals. Again, it depends on folks' risk tolerance, and we walk through what's riskier versus what's less risky. But with those personal celebrations like weddings, funerals, they do tend to be a little riskier because unlike when you're in Walmart, you are much more tempted to get close to other people, to console them, to physically touch them, to hug, that kind of thing. And it does increase your risk. And so, we still don't recommend large and medium-sized gatherings indoors. And we want to make sure that people are doing what they need to do to keep their whole community safe. But to answer your question directly, it is a mix. And I know that there are many other events that are happening without input. And sometimes we see them from contact tracing.
One more question.
Yes, Supervisor Beer, go ahead.
I've had some experience, and I think it's a great thing that, the multiple generation families, in the Hmong community especially, how are they accepting this? I mean, not as a group, I suppose, but I mean, I've been to a couple of been to one Hmong picnic, I guess. And I mean, it's like people came out of the woodwork. And I mean, do you have direct contact with leaders of, that are putting that stuff together too?
So that's a great area of opportunity, Supervisor of York. I don't know that we've worked proactively, specifically with the Hmong community or any, I don't want to say this, community with deep community and family ties, multi-generational ties. So I think that we can do better, and thank you for the suggestion. We have worked with them retroactively in large, again, multi-generational families where we have had cases that have moved through because of events like weddings or funerals or picnics, family reunions, that kind of thing. Last fall and summer, I expect that we'll see that again this summer, unless our vaccination rates get substantially higher than they are now.
Thank you.
Thank you, KT. Any other questions before we move ahead? Thanks for that. We probably will continue to be asking questions about this as things perhaps loosen up a bit, and hopefully our data will allow us to loosen up a little bit over this summer. Veterans Service Office, Greg, your report for the month, please.
Good evening, everyone. I'll start the report off with the kind of going through a few of the items that I have listed out in the memorandum format kind of highlight page. So first, discussing local activity. Probably the most important thing I'd report on this last month is our office is partnering with, it initially kind of started with being tasked to work on the movement of the Dunn County Eternal Flame Veterans Memorial from the old building, main county building, to this location. And I see Bob Colson's on as well, who's one of the partners in helping with this. But we've worked now to really to be just a partner and to kind of place that with our service organization partners to kind of be that lead on that, even though we're partner. But the most important thing is we're still moving forward on that. We do have a goal of having that Veterans Memorial out front of the Community Services Building. Another funding opportunity has come forward, and so I'll be putting in a request to secure potentially up to $8,000 that will be added into that. And I think it'll be a nice feather in the hat for the county to show this nice support for our veterans of all generations going forward, to be a nice display. So that'll be something going forward, and I'll always of course update the Human Services Board on where we're at with that. On the state benefits, I had included in your packet a potential future bill, and I apologize on my understanding of it took me a long time to find this LRB bill and what that actually means compared to going forward to the assembly and stuff. So my interpretation is that this is a thought with potential for the future. on this, and essentially what it is the recognition that the county veteran service officer support, which is from at the state level through a grant, has been static for well over 10 years since I've been in this position, and there's some support to have that increase. And again, everything's tied into county size. So we would be looking at a decent increase if this gains some traction. But I thought I'd bring that forward to the Human Services Board just for situational awareness.
Greg, if I've had some questions about that. If you knew what the timing, and apparently the timing doesn't apply, but if secondarily a resolution from the Health and Human Services Board would be of excuse me, of some assistance in this process.
I think it absolutely would. I think the kind of the next step really for me is to get a little bit more of the information based upon that timeline, so that then we can get memorialized support for that, again, because funding has been static as far as state support. So I'll bring that forward as I gather more information.
Yeah, try to bring that back to us in April if you can.
Okay.
Thank you.
So moving regarding federal, on the federal side of things, COVID, of course, is the continued hot topic. And I wanted to just give a brief update on my assessment of the Veterans Administration and their approach to taking care of our veterans. And my assessment is that they're doing a very, very good job with their communication. And that's based upon the reports from the many veterans that we meet with each week in the past months, that they are being contacted and having many opportunities to obtain their vaccination if they so want that. And so that's been very, very good, a very good communication. And so I give the Veterans Administration credit for that. And honestly, from the seat I sit in, a lot of our veterans, the multiple sources of contact, from all of the local hospitals as well, to give them that opportunity for their COVID. So I think we're pretty blessed in our part of the country, because I know people in other parts of the country that are at high risk that are still kind of sitting on their hands waiting for their opportunity. And I know KT could probably give a lot more detail on that, but I can only talk from the seat I sit in. So the next item, financial. Again, this early in the season, in the calendar budget cycle, there's nothing significant to report. Again, our budget is relatively small, straightforward items. We have very limited flex as far as any operational items. So at this point, there's nothing significant to report or highlight regarding that. On the COVID office update, emergency preparedness category, business as usual. We're still meeting with people daily, and honestly, on the, I'll just put this out there. I'm not a person who tracks steps. I'm a person that still runs. But to be honest with you, the number of trips I have to take daily to the front doors to let people in for appointments and stuff. And I'll just kind of drop that out there, that I am hopeful that we will allow our citizens to be able to get easier access here, because from my observation, again, they're following all the safety procedures and doing the best that they can. And so that would help in the efficiency of things. I've seen a couple smiles from others, so I think they know exactly what I'm talking about. But I'd rather run rather than at night when I go home, rather than walking to the front door.
You're getting your 10,000 steps to the front door, are you? You think?
I am, but I prefer to go run out on a nice rural road and nap. But again, observation of the community coming to our building. They're following everything that we ask. We can't ask much more of that. Staff wise, we're fully staffed at 2. and so we're still doing things as we need to, and meeting the need. But spring hits. The veterans benefits and related items, no different than house cleaning. People have their list of things they want to get done, and so they're contacting, and things are kind of opening in their mind, opening up to get out and get things done. So I will move without it. If there's no questions, I will move to the workload report. And again, there's two at the top. One's labeled 2020 fiscal year, and then the 2021. And I'm going to continue to provide that so we have an annual comparable, so if there's any questions, or and we're always looking for patterns, and anything that we can kind of pull out that is statistically significant, so that we can either adjust or prepare for. The impact statement, and again, we get a lot of questions really out of left field about things, and I thought it was noteworthy again because of the large number of contact we have with the community, and actually people throughout the whole country. The item number one was a kind of a third party contact to our office based upon a grant that we're working on with UW Extension. We got an email about really trying to reconnect two long lost battle buddies that had worked together in Korea, I believe it was, in the military, and in protecting all confidentiality and stuff. It ended up being a very positive outcome, and in the end, the two friends reconnected. And that isn't our business. We're not Cupid, and we're not any of those particular programs, but we're going to try to help people. That's what we're here for, the county. And if we have the opportunity to do that confidentially, we're going to do what we can if we've got time. The second item there, I've been highlighting quite a few months now regarding the VA appeals process. And in a lot of these programs, sometimes things might get missed by the evaluators, or processes may not be followed. And it's our responsibility to dig into Code of Federal Regulations, dig into precedent, to best serve our veterans, to ensure that they get the entitlements that they've earned. And I bring this because it's extremely time consuming for the number of appeals that we've been doing. It's a minimum of probably 4 to 5 hours of preparation to go back through files. We're talking 4 or 5 years a lot of times. And so have a lot of them, but it's time consuming, but well worth it when we get the positive outcomes. And the other side of it, extremely unfortunate that it takes appeals because items are not looked at or correctly done on the front end because of maybe inexperience at the VA processing level. And so it consumes a lot of time, but that's what we're here for. I just want to emphasize that level of training and expertise, the investment that comes from the county and allowing the training, is repaid tenfold by the satisfaction of the people we help. And I'm again speaking not from the veterans program, and I know we got plenty of other programs with the training that they're allowed to participate in. It only benefits the people we work with. So with that, I'll leave it open for any specific questions any supervisors would have for me.
Supervisor Steen.
Yeah, Greg, I have a question on how often would you say that your understanding of the process is better than the people that are supposed to be reviewing it?
That excellent question, but it's kind of a loaded one. So in case any VA employees are watching this live or watch recording later, I would say that there's a at the beginning level of the claims process, I would say that the expectation should be that I know more than them. And Jessica in my office, that we should know more than them at the beginning claims process to help them do their job right, because they're the most inexperienced individuals looking at these claims. But as we move through the appeals process, the knowledge of the veterans law judge should be more than mine, because they're the most experienced, and which I arguably they do have more knowledge, because that is exactly their job. Their job is understanding the Code of Federal Regulation, and but they rely upon us delivering that. In the mid-level, so I'm not directly answering it, but we have more experience, and we should, than the beginning entry-level VA employee, and they're the ones who are tasked to work on the first part of a claim.
Very diplomatic answer there, Greg. Let me ask you this. Are they getting better, do you think, over the last year or two?
I've been happy with the new Appeals Modernization Act. I think the appeals process, we're able to get to a positive outcome quicker, because they've really put their appeals in 3 different lanes, where before they were in one lane that was slow and all kinds of traffic in there, where they've segmented it so you can get to talk to a VA employee, like a decision review officer, sooner. So that's a positive. So that they are going faster. And more specific, there's been a lot of clear and unmistakable errors. You talk about knowledge on my previous answer. We've had to submit previous year a lot of clear and unmistakable errors, which are situations where the VA does not want to admit necessarily that they made an error. But I think we probably had close to 10 of them last year, which is a high volume, because that hurts their quality numbers. But that again is us making sure that we're experienced and knowledgeable in what we do.
Let me follow up, if, Chairman, Ms. Chairman.
Yes, certainly, Supervisor Steen.
Doggone it, the train left the station. Senior moment, I'll have to pass. Thank you. Thank you for the answer.
We'll come back to you if you think about it. How's that?
Very nice of you.
Other questions for Greg? Comments, compliments?
Oh, I remember.
Supervisor Bjork.
Greg, is this area that you're working in the review process, is this a regional or how centralized is this workload, and do regions change across the country, or when you're talking to people, where are you talking to them at?
Numerous locations throughout the country, every different time zone. Everything has been decentralized with the VA, so that everything goes into a hub, and they look at workload based upon regional office, where years past, everything in our area would go through the Milwaukee regional office. They had a very, very high quality rating and very well respected, but the VA decentralized everything to spread the wealth throughout the country, because they had other underperforming areas. So I just did a higher level review, which is in one of the appeals process, with somebody from the state of Washington at that regional office, and Florida, it was, I think, last week. So it's all over, but at that level, they're professional and they're knowledgeable, but I would definitely prefer it to be local. So I have a lot of trust in our Midwest folks.
Supervisor Steen, did you?
Yeah, I was just going to comment, Greg. You're a straight shooter with us, and I assume you are with the National VA. And when you bring a case, I should imagine that the questions you have merit. Have you found that that stands you in good stead when you bring up a question?
Yes. You catch more bees with honey.
Yeah. Okay. Thank you.
Yeah.
Any other questions? We're fortunate to have you, and thank you for another excellent report. And
Thank you.
We appreciate it. And that was such a nice story of the Korean War veterans reconnecting. And you know, keep us posted on this bill, because I'm sure you would like to have your state grant doubled.
Tripled if they'd let it. Yeah.
Tripled.
Yeah.
Tripled would be even better.
Yeah.
Thank you. Thank you. Moving on, Department of Public Health Staff Report. KT sent out information earlier this afternoon. And I assume that you all have had a chance to look at that, but I suspect she is going to share her screen. KT?
Absolutely. Krista, would you let me share my screen?
Sure. 1 second. Oh, you got it.
Awesome. So what you guys have up on the screen, and one of the things in your packet, is the situational report that I've put together, or my team has put together. I am working to get that to you a little bit earlier, trying to find that balance between up-to-date data and get you enough time to where you can actually spend some time and snuggle up to that data. So a couple things that are in here that maybe look a little bit different. I gave you guys a PDF of the update that we put on Facebook once a week now, instead of taking a screen snip, so that you guys can see where that data is coming from, and maybe blow it up and the resolution a little bit better. But in its stead, I gave you guys a screen snip of one of the resources that I have on the kind of back of the house accounting of cases, and it shows cases over time. And I think that this is, so two things to note, that this is by date of onset. So it's not the date that they have the test, but it's the date that they start to feel sick. So it's a more accurate representation of cases over time, because some people wait a week, sometimes even longer, to get tested. And you can see that we had our beginning kind of peak when we had students come back in Dunn County, and then we had that significant peak in November. We've enjoyed a gradual reduction in cases, but these cases right here are preliminary, because we're still getting cases come in that their onset is 2, 3, 4 days before, and so this is incomplete data. What I do want to share with you is that we are seeing an uptick, and you can see that in the activity that was shared in the same report, where over time we're starting to increase just a tiny bit, but it's enough to make my antenna go up. We are seeing folks, we had a case today where they just came back from spring break in a very warm state. Kiddo came back to school, was symptomatic on Friday, wasn't tested until Tuesday. And so we had 3 days of exposure to their entire classroom. Again, it's a travel-acquired infection. Again, when people are not vaccinated, kids can't be, and engaging in high-risk activities, they are more likely to get sick. And we will see a bump in cases following this kind of snow globe effect, where we're sharing germs and bringing them back home. So cases, one of the indicators that I talked about earlier was cases per day. We were enjoying about 3 cases a day here in Dunn County over a 7-week period for almost 2.5, 3 weeks. This week we're up at just about, so if you look at the activity, we were at just about 4. And this week, as of today, we had 12 cases today, and we're going to average more about 5. And it's definitely on the uptick. And I think that that's an important information to kind of digest. One of the other indicators that we talked about earlier was percent positivity. Again, it's still under 5%, which is that threshold for CDC, but we are seeing a gradual increase now at 3.4% by test. So something I'm definitely watching. Not to give you guys motion sickness, and I apologize for the scrolling, but some more information that the state has put up about immunizations. And so they've broken out the kinds of 3 vaccine that we have available to us. Here in Dunn County, we have been using Pfizer vaccine. We will get a small allocation of Johnson & Johnson next week, and we hope to use that specifically for some of our homebound individuals or folks that have significant transportation barriers, in addition to some populations that may be more transient, like in our shelters or in our jail. I wanted to point out kind of that slow start that we had here in Dunn County, and I know that there's been a little bit of reporting on that, really connected to our demographics here in Dunn County. The bulk of our job generators really are in education and manufacturing. We don't have the really heavy healthcare like we do maybe in some adjacent counties. And so we didn't get started in earnest really vaccinating until late January. And so we're just now seeing our second doses picking up. And so I'm excited that about 50% of our individuals here in Dunn County that are 65 or better have received 2 doses of vaccine, and that's a good starting place, and we need to continue to build on that. One point of clarification, the United States has about 1/4 of the world's COVID cases, positive cases, and about 30% of the doses of vaccine have been delivered worldwide, have been delivered in the United States. And I think that that's an interesting kind of parallel to have some awareness around. And then finally, for your awareness, there's a lot of conversation about CDC's guidance to return to in-person instruction. So they've put a data portal up that looks a lot like the Wisconsin data portal, I would say about 5 months later. So the numbers are comparable. There's a difference in data reporting. In some instances, there's a couple more day lag for CDC, but the data is from the Wisconsin DHS and will eventually catch up. But the CDC guidance has encouraged people to return to in-person instruction. We never left in-person instruction here in Dunn County. Many of our schools started the year in the fall trying to use a 3-foot physical distance as their baseline, but they very quickly found out that we were quarantining many more kids than if they would keep that 6 foot of distance. At this moment in time, the CDC has not changed their guidance on what constitutes a close contact, which is closer than 6 feet for more than 15 minutes cumulatively over a 24-hour period. And so if we have kids going back in person in the fall, there is still that likelihood, if they're 3 foot apart, that we would have very large amounts of classrooms being excluded because of being identified as a close contact. And so those are the really important kind of high-level responses. I also provided in the packet hospital data, something that I use to inform where we are with opening. Also, this is the regional information. You guys have this in a PDF form so that you have all of, this is the Facebook post so that you guys can get up close and personal and have a better resolution on where we are. Let's see, you also have in your packet, the respiratory report. So this is something that I provided you for the 3 years that I've been here in Dunn County, is our influenza report, respiratory illness report. And I just pulled up this graph so that you can see we have almost no influenza here in Wisconsin. And that's because the things that we're doing for COVID, the physical distancing, the wearing masks, the good hand hygiene, the not coming to work when you're sick, also work to prevent the transmission of influenza very effectively. So there is some PCR positivity, but a very small amount. And then the last thing in your packet is the regional update. And again, I wanted you to have these so that you have the live links and could do a little more reading if you cared to. And then I think the last thing that I wanted to just share very quickly is that I will be working for two things for next month. One is an MOU with our local EMS partners so that we can meet the criteria and the emergency use authorization to provide emergency services for homebound individuals that need to be vaccinated. We're required to have people stay 15 or 30 minutes after their vaccine. We want to take vaccine leaning into our partners at ADRC to folks that are physically not able to leave the home. We need to get support to make sure that we have emergency services available to manage anaphylactic reactions. Knocking on all things wooden, we've not had to deal with that this year, but we need to be prepared just in case that was to happen. And so working on an MOU to bring back to you. Also, we get a lot of thank you cards, and I'm remiss in not sharing them with you. We had a lovely individual come from an adjacent county that was being challenged to get in and get vaccinated. They worked through our phone system. We got them in, got them vaccinated, and they left not only a thank you card, but a little thank you check as well. And so that'll come to you as a budget adjustment. We'll put that back into the vaccinations, probably for like the little buttons that say I got my vaccine or something along those lines. And of course, I'll send them a thank you note for that very thoughtful gesture. So those are the two, in addition to the packet that you have, items that I wanted to share with you today. Any questions?
Any questions for KT? Supervisor Bjork, you're muted, by the way.
Just the wrong button. Well, I just have one question, and I don't want to be snarky or anything, but I went in and had my first shot and my second shot, and all I noticed went up and down the hallway over at Oak Leaf and Eau Claire was just a bunch of people that seemed to be my age, and I kind of thought, well, how many of these are 80? How many of these are 70? How many of these are in the 60s? And it never occurred to me to even consider, excuse me, but what does race have to do anything with it? I mean, you had the one graph for the 13% whites are receiving shots and only 1.7% African Americans. And so what does race have anything to do with this, and why would that be brought out as a statistic, in your opinion?
All right, so this is the graph that Supervisor Bjork is sharing, and you can see that for the state, they do break it down by demographics, as well as by age and by sex. So what that has to do with and why we track is because some of our communities of color specifically have more adversely been impacted by infection rates than others. And so we have an overrepresentation of Asian or Hmong families within our case counts by percentage within our population. And there are some socioeconomic reasons for that. Like having very large extended families and deeply committed family structures. But there are also some access issues. So with infection and adverse health outcomes, if it's harder to navigate a health system, sometimes then if you wait longer to get help and your outcomes are worse. So we really want to make sure that we prevent infections in communities of color that have had disproportionate adverse health outcomes so that, we can prevent deaths. And that's honestly what we're looking at, all disproportionately impacted communities. And I would share that our rural community is also disproportionately impacted because of those same reasons of, large extended family structures and perhaps less access to our health systems. And so we want to make sure that we target these communities with to remove access barriers and make sure that they get vaccinated just as soon as we can. Does that help?
Yeah, it really does. It's just that, it's I don't know. I mean, I don't know what to say about it, but it's like it just never occurred to me who was sitting next to me or ahead of me or behind me. I can see the possibility of maybe not having transportation or access, and I see the rural thing, exactly what you're talking about, because it's you gotta want to be there or you wouldn't be there. So thank you.
And Katie can correct me if I'm wrong, but people often in low income or communities of color have much more limited access to healthcare in general and carry a much greater load of pre-existing conditions like diabetes and so on. Because, I mean, for all sorts of reasons, access to healthy food, access to healthcare and so on. It is a significant issue. Other questions for KT and before we move on? I guess not, KT.
Awesome. Sarah, are you able to present financials today?
Yes, I think so. Make sure I get the right screen. Can everyone see the public health financials that was given out in the email?
Yeah, thank you.
I did blow it up a little bit so everybody can see that okay. I'll start with the expenses. This is for, it's labeled February of 2021. That means it has all of January's expenses in here. So it's truly January, but it was ran in February. So year to date for public health, we show $373,427.71 in expenses. I'll move to the revenue tab. This shows that year to date, they've brought in $66,709.20. This is probably about 2 weeks of revenue into January, being sort of the same way human services is. The billings go out and the state for payments of cars and stuff is about 2.5 to 3 months behind. So we won't start to see revenue coming in for January expenses till probably the April financial, which will be done in May. That's when those will start coming in. They're pretty far behind at the state of reimbursing us for expenses when we turn them in. Nothing out of the normal to point out, but does anybody have any questions on that?
Any questions for Sarah? If not, pretty clear, thank you.
You're welcome.
KT, do you have anything else?
I do not.
All right, thank you. Moving on to the Department of Human Services staff report. Sorry about that.
So I provided you a paper that's entitled Spring 2021 Projects. I'm not going to go through all of those. You're capable of reading them. I just want to draw your attention to the very last item 8, because I think that as we consider the impact of COVID on people, but particularly our workforce, it's notable to consider this this data. So a couple of weeks ago, I was involved in a half day webinar conference, actually, by a business that owns a very large employee engagement platform, or app for better word, but it's a platform. So they basically contract with large companies over 500,000 people, or sorry, 5,000 people around the world, and they spit out things that are called pulse surveys. So they'll send out a quick survey out to all the staff of that company, just asking 1 or 2 questions to kind of touch the pulse of that company. And they look at employee engagement, burnout, just how are their staff doing? Because particularly in private business, your engaged staff directly drive your profit margin. You don't want disengaged staff, or you don't want burnt out staff. And so the group is called Limeade. And a number of years ago, I got on their mailing list. And so even though we're not an organization of more than 5,000 people, I get all of their information, and it's always very helpful. So they did this conference, and they presented on the concept on the subject of burnout. And so one of the things that I think it's really important to note when you hear people say, well, I'm burnt out, in a variety of settings and variety of circumstances. You cannot be burnt out if you were never on fire. So burnout comes when you have a really long time of intense investment and you don't have enough of the right kinds or enough sufficient supports to support you through that. And so, that's not necessarily anybody's fault. It just means that you get to the end of that, and it's, you can kind of in exchange for a lot of people, you can exchange exhaustion. So when you think about the things that have impacted our workforce in terms of being tossed out to figure out exactly how to do remote work and make connections and still be doing their work well, when you think about people that have been tossed into figuring out how to care for children and their educational needs and their childcare needs, or on the other side of the equation, perhaps aging parents and their needs, and then navigating the systems of getting people tested and not tested and all of those sorts of things, and then now vaccinated and all of the movement and all of that. Pre-COVID, when Limeade surveyed their workforces that they represent of these large companies, about 35% of the workforce at any given point in time would consider themselves to be in a stage of burnout. Now that's a high number on a good day, right? But now, when they do it now, it's 72%. That means 72% of people in our workforces across the country are coming to work without internal resource to navigate doing their best job on the job. And again, it's not anyone's fault, but I think it's really important for us to think about. And I tend to, I've told you this before, but I tend to those things because I have a very young, on average, workforce. I have 12 baby boomers left out of almost 100. 12 of us. I'm a dying breed, literally. But and I have probably at least equally, if not more now, because we have 12 interns, honestly, right now. So if I throw them into the mix, we have at least 12 now who would fall into that youngest generation of what are called Gen Zs. And whether I want to tend to their emotional and work well-being or not, if I don't, they won't work here. And so I just thought it was really, really interesting. That number kind of blew me away. I mean, after I think about it, I can think of all the reasons why it is, but it's a really telling number. So we have a lot of work to do of repair to having people to mitigate what collective impact that there's been over the last year.
And I just wanted to point out, I know that Supervisor Cromwell has been really interested in the idea of making calls to people who might be shut in or lonely. And I just wanted to point out number 6 in the ADRC and its Caring Calls program. I thought that was something, Jody, that you might be interested in learning about if you didn't already know.
Yes, thank you. It's a wonderful program.
Good.
What's really interesting about that program is that there is equal value to the caller and the callee. So Dodge gets regular feedback from some of the people that are making the calls, and they are just super excited to be engaged in that, and they're just loving the connection that they have with folks that are so eager to just share with them and share their life. And many of them are making plans for post isolation when they can go out and have coffee together or whatever. So there are going to be some residual great value to that. What's happening in that program.
Yeah, very nice. Supervisor Steen.
Yeah, Chris, would you think that the younger folks, they're thinking about things with their lack of experience in the workplace and in life generally, add to that dissatisfaction?
Well, I don't know that number, that burnout number, is related to just the youngins. I think that it's if you think about, probably one of the more at-risk groups would be those not the 20, 21, and 22, 25-year-olds who may not be balancing all those things. There are 35 to 45-year-olds, or some, who have maybe teenage kids or late adolescent kids who are not involved in all the things that they were involved in. I think that it's across the board number. So it's just as likely that it's the me's of the world, or my other 11 baby boomers in my office. But it just is illustrative of the demands that are different in the workforce than anything we've ever experienced before.
If I might make a comment, it's been my experience when I talk to people, let's say 55 or so, and it really doesn't matter what line of work they're in. After doing a job for 30 years or so, they're ready to quit. But most people can't quit because they don't have health insurance. And so they hang on as long as they can. And I found it interesting that it really doesn't matter what kind of work they do. I just find that to be kind of a fairly common thing. That's just my life experience.
I would agree. That's all I've got for that.
Question for Chris.
Oh. Yep.
Yes, please, Supervisor Bjork.
Thank you. I wish I had it with me. It's out of my pickup truck, but today's Eau Claire Leader on the bottom half had an article about social workers, and it was really very, very good. And is the recognition that the guy on the bottom and how he felt about his job, I thought was really interesting. But I never got into inside of the page. But is there some social worker recognition or a week or something like that coming up? Or
March is considered Social Work Recognition Month.
Good enough. Well, a month is just a good start.
And maybe that's something this committee could consider.
Yes.
Moving on to the financial report, if we're ready. And Sarah, I don't mean to put you on the spot, but you gave us a lot of documents today. I wonder if you just would tell us what they are, just to make sure that everybody understands.
Actually, I was going to share my screen. Chris and I did some updating and give you the latest and greatest that we could for our first start of a financial. It's not the audited financial, but so we did some touch-ups. So I'm just going to do a summary for you guys. We gave you detail, but we'll just give you a summary for now. And I also have the January ones for you. So can you see the orangish and green screen?
Got it.
All right. And on the bottom, it says 2020 financial as of March 2021. Can everyone see that? I'll assume yes.
I think so.
Okay. All right.
Yeah, sorry.
I'll just skip to the projected 2020. Again, these are just summary numbers. Your copies have a little bit different, but Chris and I went through these, updated them, tried to give you the latest and greatest numbers. So the grand total expenses for DHS for 2020 so far is $13,315,891. And that breaks out to the operating expenses of $8,266,651. And the salary for DHS is $5,049,240. So then what we have is our budgeted expense, which checks back to the $13,315,891. The revenue that DHS brought in so far for 2020, this is state grants, donations, insurance billing, all of that is $9,460,196. With those, it shows that we are going to use $3,855,695 of county levy, which in turn then that yellow highlighted square says we're going to give back $241,013 from the budgeted $4,096,708. Is there any questions on that?
Well done and well managed.
All right.
What I would say about that is that number will move and change. We're not going to update it for you until until you'll see it in July when you get the audit numbers. I know that we have somewhere between $75,000 and $100,000 coming yet from the income maintenance, economic support side of things. There are numbers that will move that. I mean, in revenue, we didn't include it because we don't know what the dollar amount is. So these numbers will continue to move around, but we will, unless there's something totally unforeseen, we will end up solidly in the black.
Supervisor Steen.
Yeah, Sarah, thank you very much. And I thought that they just took my hip out, but I believe they took all the questions out too.
Oh, no. Maybe in January's presentation, you'll have some questions, Gary.
All right.
All right.
Or maybe she just does such a good job that she just takes away your questions.
True.
True. I'll just keep my shared screen up if you guys want to. I'll switch to the January 2021 presentation. They're the same colors, so you've just seen a flip of the screen. There's not much to report here. These are very raw numbers right now, and in the projected, we show if we continue to spend the way we have, this is just roughly January's numbers that are in, and it has January and February salary in it. So we're at $11,598,821 projected if everything stays the way it's supposed to, or we want it to, I should say. And we project that we'll bring in revenue at $8,626,800. And at this point, it says we will only use $2,972,021 of county levy, and it shows $1,206,895 to give back. But again, very grim numbers per se. You know, they're not. We don't have a lot of expenses or revenue in, so time tells we change quite a bit from here. Any questions?
Any other questions for Sarah or for Chris? Hearing none, apparently we are ready to move on.
All right, thank you.
We have a number of action items. The first, it says it's number 9 on your agenda, but we skipped number 8 on your agenda. Doesn't matter. Action items. Vouchers paid for January in the amount of $389,468.73, and Supervisor Bjork and all the other members, Chris has been providing additional detail on who and what organizations are supported by those vouchers. So I need a motion to note review of the January DHS vouchers. Supervisor Steen, is there a second? Supervisor Cromwell, thank you. Any questions, any discussion? If not, all in favor say aye.
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 Opposed? Vouchers are noted. Mr. Coulson has been extremely patient. Uh, The second action item is a discussion document on our directional plan. You will remember that we talked about this initially last month, and it was agreed that a kind of collaboration would move forward to bring back a recommendation to the executive committee, and you have that. You've had it in your packet. I'm going to turn the discussion over to Mr. Coulson, if you don't mind, Bob.
Thank you, and good evening, committee and guests. Yeah, I really want to thank KT for the work that her staff has done on this. I mean, I didn't expect that we would get this for tonight's meeting, and I realize, you know, with COVID, the amount of work that and workload that she has, and so I just want to really thank KT and her staff for getting at this so that the committee can review it. So I hope that everyone had a chance to read it. I have it if we need to share it on the screen, but do I need to share this for the committee? Do you
Has
think,
anyone
Chair?
not had a chance to look at this? Do you want to bring it up? Yes, no? I see heads shaking no. All right, we've read it.
Great. That means that you did a great job in getting at this, KT. So, you know, if there aren't any questions about this, I guess, you know, the notion behind all of this is trying to get some traction with our directional plan, and the big ticket item was things that all these committees have been working on that could be converted into, you know, some sort of a policy. And, you know, for this committee, for, you know, the question was, how can we incorporate health and well-being into all policies? That's a pretty broad statement. And so, you know, I think I'll just read maybe what the policy is, and then leave it at that, and you guys can read the implementation techniques. But Dunn County is committed to maintaining and improving an effective, comprehensive public health infrastructure, which is essential for promoting individual and community health and for responding to issues such as disease prevention, chronic illness, monitoring, food and water safety, and health emergency management. You know, given that, how can you incorporate health and well-being to all policies? That policy statement is equally broad, and I think it gives this committee and this group a lot of latitude going forward in how to plug things into this policy. So the hope is that, you know, either at some point in time that your committee is comfortable with the policy, that they agree with the language in the policy, that it's complete, and that there would be action to move this on to executive, so that we could then at some point amend the directional plan to include this policy as well as the other policies that are being worked on right now at the county. So without any other fanfare on my end, I guess I would turn it back over to the chair to see if there's questions, comments from the committee.
Thank you, Bob. Thank you for your work. And County Manager Miller also had a hand in this, and certainly KT.
Yes, thank you. I did not mention Mr. Miller. He's been instrumental in this.
Yeah. I agree with Bob that this is fairly aspirational, but I think it's important to recognize how important a robust public health infrastructure is to absolutely everything else we do in the county. So I would be interested to hear responses and reactions from the committee to the policy or on any of the proposed implementation items. The idea on this is that it will come back to us periodically to have a look at it. So it is entirely possible that things might get added at the implementation stage, or the policy itself might be tweaked a little bit. But reactions from the committee, please. Katie, it looks like you did a really good job. And Bob, no responses. Okay, then what our next step will be is to pass this on to the executive committee. So I will need a motion to that effect, approving the policy as written and forwarding it to the county executive committee for subsequent action.
This is Bill. I'll make that motion.
Thank
I'll
you, Mr.
second
Lamb.
that.
Is there a second? Bonnie?
second that.
Bonnie Barker seconds. Any additional discussion, questions, comments? If not, all in favor say aye.
Aye.
Aye. Any opposed? This will move forward then to the executive committee. Thank you.
So,
for your-
Madam Chair,
for your work,
I will
Mrs.
take
Coleman.
care of making sure that the document gets over to Mr. Miller so that it gets onto the executive agenda. I mean, we've
Okay.
been corresponding back and forth, so I'll make sure that it gets in his hands so that he can get it on the executive agenda.
Excellent. Thank you. Thank you very much for your work on this, Bob. I know how much you have on your plate as well, so we appreciate it.
We're all busy people.
Okay, action item number 3 is a DHS budget adjustment. It should be pretty self-explanatory, but I will ask Chris or Sarah if you have anything to add.
I would defer to Sarah.
Anything,
I
Sarah?
don't have anything to add, just this is our first budget adjustment for 2021. So we are shoring up the contracts when we do the budget. We're not 100% sure what our grant awards will be. So that's why this one is so big and it's got a lot of information on it. So we're trying to make sure SAP is as accurate as it can be to give you guys the best financial picture we can.
Yeah, and this is largely grant support.
Yes.
I need a motion to approve the DHS budget adjustment. Supervisor Steen, is there a second? Bonnie Barker, thank you. Any additional discussion? If not, all in favor?
Oh, you muted.
Aye.
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 Any opposed? This will go forward to county board. And then we have some items under reports, resolutions, and ordinances to go to the county board. All of these, I was going to say almost all of them, all of these are related to the CDBG grant that we have looked at several times. They obviously are very interested in the county's sort of process and infrastructure. Chris pointed out at one point that they're more interested in process than they are in what we propose to do with the grant support. But these are items that are being requested by CDBG to move that grant forward. Chris, I'm going to turn this over to you.
So that's exactly correct. Actually, A and C both were part of our original submission. Diane's right, our original grant submission was 62 pages long, 4 of which were actually related to what we intended to do with the money. And they had no questions about what we were going to do with the money, but they had some issues with, so they came back, contacted me, the Department of Administration contacted me and said our housing ordinance, which was passed back in 1997, was outdated, had the wrong references to it. And our resolution, our residential anti-displacement and relocation assistance plan was outdated as well. And that was passed back in 1997 as well. And so those have both been vetted through Corporation Council to update them with the proper language and statutory references. And then they also said that we had missed one line on our citizen participation plan, which said, I'm not kidding, which said that we needed to indicate that the members of our citizen participation group would include at least one person who was of low to moderate income. So you did approve that plan the first round through. Now it has one additional line which says that we will have one person of low to moderate income.
And I'm just going to point out that the ordinance repealing and recreating the Dunn County Fair Housing Ordinance will come to the county board, and I am going to move that we waive a second reading. I'm going to want somebody, one of the other supervisors, to second that so that we can expedite this process of getting this information back to CDBG and moving forward with the grant.
They'll send us an award letter to say that we've gotten the money, but they won't let us spend it until we have these things in place. So the faster that we can do that, the better.
Okay. All right. So let's take these one at a time, unless Chris, I think we better take them one at a time.
Yes.
A, the ordinance repealing and recreating the Dunn County Fair Housing Ordinance. I need a motion to.
I so moved.
Supervisor Steen.
Second.
A second from Ms. Barker. Any further discussion? If not, all in favor say aye.
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 Any opposed?
Oh, you're muted, Diane. You accidentally muted yourself.
Second time tonight that I said I didn't want to do that ever again. Okay, B, resolution for CDBG Citizen Participation Plan Amendment, as Chris has indicated, to add a person of low to moderate income.
I make a motion.
Thank you, Ms. Barker. Supervisor Steen is a second. Any discussion, questions? If not, all in favor say aye.
Aye.
Aye. Any opposed? That resolution is approved. And finally, resolution to adopt a residential anti-displacement and relocation assistance plan for CDBG. Again, I need a motion to approve. Supervisor Steen, is there a second?
I'll second.
Thank you, Supervisor Cromery. And any further discussion, question, or comment?
I have one.
I'm sorry. Yes,
Yeah.
Supervisor Bjork.
I don't know if this is the right place to bring it up or even how to do it. But, listening to Chris talk earlier about her staff and the social workers, and seeing that is this month social worker awareness or social workers way to go, gold stars. I mean, I think that, we as a committee should recognize our social workers in a resolution of some sort that could go to the county board. And also,
all right, let's get to, we're going to act on this motion at the moment, but let's get this on the agenda for next month, okay? Because I think that's entirely appropriate. So again, we're on the resolution to adopt a residential anti-displacement and relocation assistance plan for CDBG. All in favor?
Aye.
Aye.
Any
Aye.
opposed?
Oh, you're muted.
I know. I did it again. I did it again. Sorry. And that is everything that we have on our agenda, except for Supervisor Bjork's suggestion that we move some kind of support for our social work staff on the agenda for next month. And we could do that for all of our staff that's just been doing absolutely incredible work over the last year. Yes, Supervisor Steen.
Yes, when we have our executive meeting, Diane, just remind me and I'll second that motion that we waive the reading.
Perfect. Yeah, and then we can just move this forward. I'll appreciate that, Gary.
That'll be at county board, not at
okay.
executive.
That's
All
right. Did I say executive?
No,
Okay.
No, he said executive.
Okay. We knew what we meant.
Okay.
Okay.
I just wanted to make sure it's at county board.
Yeah, thank you.
Okay, any other announcements or?
Yeah, can I just do one real quick one? I did send
Please.
you guys out a email inviting you to participate in Human Services Day at the Capitol, which is virtual, which is actually not on Human Services Day at the Capitol because the legislature is in session that day. So I have a series of meetings set up in the week of April 12th through whatever the end of that week is, and a one on the following Monday. I believe that there are 7 altogether because we have those little tiny pockets like the upper western corner of the county where Janet Bewley is our senator for probably one township. I don't know.
He isn't, but.
She is.
She is for New
She is.
Haven.
She is? Because I thought
Yep.
I checked her Senate district and it wasn't
No,
listed.
for New Haven.
Okay.
Yeah. So we have these. Go ahead.
She came to our legislative.
I know
thing.
she did.
Yep.
Yeah. So we have 7, I believe. So I have 7 meetings scheduled. If you want to be a part of any or all of those, just shoot me an email. I'll send you the dates and I gladly add you to the Zoom invite. We've coordinated with local counties who share the same legislators. So there'll probably be fairly large gatherings in virtual world, but they would give you an opportunity. They always are interesting to hear the multiple kind of perspectives on some of the proposed budgetary legislation related to human services, as well as what the representatives have to and senators have to say.
Excellent. And I just wanted to point out that in your packet this month was, and you've seen some of it or all of it before, but I just wanted to point out that we included the Community Health Needs Assessment Report, and towards the back of that report is a set of goals for the Community Health Improvement Plan. And I think that's, first of all, I think it's important for us to know about that. And secondly, it's important as we think about the importance of health in the county's directional planning. So it's very nice to include that again. And if you haven't looked at it, I strongly encourage you to do so. Anything else, colleagues? If not, I want you all to stay healthy and we are adjourned.
Stay well.
Thank you, everyone. Have a good evening.